Alright, hello everybody, it's Erin and Kaitlyn from Choice. We are starting a new video series for the month of September talking about injury prevention in athletes. For this first week, we are focusing primarily on female athletes and injuries, or the most common injury that happens at the knee, which is an ACL tear. We wanted to just go over why this happens, movements that sort of predicate or predispose people to having this injury, and a few exercises that you can do right at home to try to prevent and strengthen the areas around so that you don't have these injuries. So Kaitlyn's going to go over a couple reasons why your knees might be at risk.
So for female athletes, the little groove where the ACL runs through is narrower in women, which makes the ACL actually a little bit smaller. So that can predispose that ACL to rupture when something occurs during a sporting event. In addition to that, women tend to have more strength in their quads than they do in the big hamstring muscles in the back. So for athletes who run, like soccer players, lacrosse players, basketball, as you're decelerating, you're slowing down. All the control is coming from the front and none of it's coming from the back. So that can cause a little bit of increased stress on the front of the knee where the ACL is controlling the motion. In addition, we have something called a wider Q angle, which concerns the hip and the inner knee. With wider set hips, it increases some stress on the inner knee for women.
Great. And fun fact, I forgot it earlier, it's not that fun, but it's how many female high school athletes actually injure their ACL each year, and it's 20 to 80,000 high school athletes. So it's very common. It's something as physical therapists we see, which is why we want to put some information out there. We have Michaela here. So Michaela, if you don't mind coming over, we're going to go over 4 of the most common movements that can have an ACL injury. So the first one is basically changing direction. So I'll have you come back here first, and I'll have you just run towards that post and then change direction over to the left. You go nice and slow. Go ahead. And then turn to the left. Great. Good job. Michaela here did it very well, but what can happen is with that sudden change of direction, that stress on the knee. The second thing, if you want to start right in the middle, is running. Go right ahead, run towards Ace and stop very suddenly. Ready? Stop. All right, so that quick stop, if you don't have the deceleration control, it can put a lot of anterior stress. The third one is, this one is very common in soccer, basketball, where you land on one leg and the stability is not there. So you jump up and try to land down on one leg. Good. So when we as PTs check out the mechanics of how that stability and that control when you land down. And the last one, which we will not show, is colliding with somebody else. So when you're out on the field, the intensity is up and you actually collide with somebody, that can cause another injury.
Alrighty, so a couple exercises we're going to go through with Michaela today to strengthen her hips. I'll have you start laying on your back for me. Perfect. And we'll do flat on your back, bend both knees. So Michaela's going to show us the glute bridge, which helps to strengthen her glute muscles in the back, help to increase the stability of the knee. So go ahead, show us 3 glute bridges. Perfect. Awesome. And Michaela looks great.
One way we can actually make this a little harder is we're not going to have Michaela do it, but on the affected side, you can do it with one leg. So you would do a single leg glute bridge.
And then we'll add a band around Michaela's knees. Perfect. So go ahead, lay flat on your back. We're actually going to have Michaela press out against the band here, so it's going to work those outer hip muscles, create a little bit more stress to some of those postural stabilizing muscles, again helping her to stabilize her knee. So let's try 3 pressing out against the band. Awesome. And I can also ask Michaela to break it down and just do one leg at a time, which makes it a little bit more tricky. So try just that left leg for us, pressing out 3 times that way. Perfect. All right, and Michaela's going to keep that band on and stand back up for us.
Do you need help? Nope. I also have a Troy athlete here. Shout out to the Trojans.
Our last one, we can change the way the resistance band is positioned. The harder, to make it harder, the lower down on the leg it goes, the harder it's going to be for her to move against it. So we're actually going to start with some side steps. So we'll do 5 to the right and then 5 back over to me.
Then you want to be focusing on that knee, pointing out towards the outer toe. Great job. And then go back. Perfect.
So these are some good ones that you can use during your preseason training to help you to keep your knees healthy and strong.
All right, thanks everybody. This is our first video for injury prevention, and thank you, Michaela, for being our athlete to show the instructions. Good day.